Hi, I'm Dr. Cheryl Karthaus, naturopathic doctor, and today I'm going to demonstrate how to roller our neck and face. This is to help open up the drainage for this whole area as well as in the face. It might be recommended for a number of reasons. Maybe there's face swelling, maybe there's brain fog, any of skin issues, different things like that where we may see a little bit more swelling or puffing or anything that we want to help the area drain, or maybe it's been prescribed to you for different reasons. So what we want to do is start off with the base areas near our neck and then move up to your face. We want to open up all of this drainage before trying to drain other areas. And this is what we're going to use, a roller. Often you can get ones that are a little bit wider, a little bit smaller, just whichever one suits you best. You can use it cold as well if that's something that feels better to you on the skin. So you want to make sure you have access to the area. And what we're going to do is actually first open up the area that's close to our collarbone around here. And then there's this muscle here called the SCM that we're going to follow. So first we want to roller around this collarbone area and just do little strokes up and down. And you don't want to apply too much pressure. When we apply a lot of pressure, you actually collapse the lymph system. And we want to allow it to stay open. So with really light pressure, we're just going to roller along the area, and you can do underneath the collarbone here as well. And you can do all the way out to your shoulder bone. And we're just using really light pressure, going back and forth using these up and down movements. And then we want to get bigger and go up all the way around the neck, between the collarbone and all the way up to that bone, the bottom of your occiput, the back of your head there, the back of your skull, and up and down that whole area. And you may actually start to feel some movement. I can feel a little bit of drainage happening already just from those movements. Sometimes you won't feel anything, and sometimes it will take a little while before you'll feel it. So you want to go all the way up, hitting that jawbone, all the way back down, and just moving back and forth around that area for a minute or two. And then we're going to move up to the jawline. And again, with these back and forth movements, we're going to go right up to hit that jawbone and then down on the neck again. And again, we don't want to press too hard. We just want to do a really, really light movement. You're just rollering over the skin. It really shouldn't feel like much pressure at all. And then we want to do the other side before we move up closer to the neck. So again, we're going to roller under the collarbone and then just above the collarbone. And then starting at the base of the neck. And then rollering all the way up along this SCM muscle here that goes all the way up and attaches at the back of the skull. And then again, up to the jaw. And little strokes along the jaw. You can do this maybe in your car while waiting for different things. You could do it in line somewhere if you wanted to. You can do it while watching TV or reading a book even. And once all of this is opened up, and then move up to the face. We're starting at the very side near our ears. We can roller up and down here a little bit, and even behind the ear. And then along the jawline, down from the side all the way out to the middle. And here, sometimes you may want to press a little bit harder around some of these areas where the muscles, our chewing muscles are. You can actually feel that as you put apply a little bit more pressure, you may actually notice that it's a bit tender. Often our chewing muscles are a little bit tender. And then we want to do the other side too. And again, up and down close to the ear a few times, and then behind the head. And then from the jaw all the way out. And just play around with it, see what suits you, see what seems to feel better. And after we've done the bottom part, we're going to move up and go along our cheekbone. And then we can move up towards the head as well. So up, then little strokes towards the temples, and then across the forehead. Even across the eyebrows, you might find that some of your hairs get stuck in the little device here. As long as it's not uncomfortable, I don't think it'll be too detrimental. And just moving back and forth, kind of going halfway across the forehead, and you can go all the way into the hairline. And again, if you add a little bit of pressure, or even just with really light pressure, you may start to notice that some of these muscles feel really sore as you're moving your stone across your face. And that is often because all of those muscles have a lot of tension in them. And so this helps to release the tension, may help to get rid of wrinkles as well. You can do little strokes and bigger strokes, whichever suits you. And then up around the temple area. And then again, all the way to the side of the hairline and into the middle. You can do across the whole forehead as well. Maybe focusing on some of the areas that do feel tender, because it will help to better release the tension in those muscles. And make yourself presentable afterwards, and you're all set. Thanks for joining. Let me know if you have any questions.